Thanks, Amy. Brooke, were you going to show the epi curve? Yeah, this is our epidemic curve. And I think anybody who's been on these calls has seen it multiple times in the past. And I think the good news is the right-hand side, despite Delta, we have not yet seen interruption of our downward trajectory that was established in mid-April. So Delta used to be called B.1.617.2. So I guess Delta is a little less of a mouthful. This variant was recognized in the Indian subcontinent in October last year. Didn't do a lot for several months, but during April and subsequently, it has been responsible for an ongoing catastrophic surge there with tens and actually hundreds of thousands of deaths, hospitalizations, and collapse of the healthcare delivery enterprise in many places there. It's now in more than 90 countries. We have data that's probably applicable to the United States, coming especially from the United Kingdom and Israel, where this variant has replaced what we now call Alpha, the UK variant, or B.1.117. B.1.117. Delta is 50 to 60% more contagious than that variant and about twice as contagious as the original wild-type virus that started the pandemic last winter and spring. The early data from the United Kingdom and Israel is telling us that even in developed jurisdictions with high vaccination rates, looks like it's about twice as likely to put infected people in the hospital as the Alpha variant. It has spread in the U.S. and it's on schedule to become the dominant variant over the next several weeks. Of particular concern to us is that half or more of the infections in Health and Human Services Region 7, that's a big swath of the Midwest, are Delta variant, and that includes the sequencing that's being done at the State Hygienic Lab at Oakdale. I've spoken to the leadership there as recently as Friday afternoon, and we're past 50% in terms of our sequence variants being Delta. Nationwide, the rate is between 25 and 30%. The available vaccines remain effective, albeit at somewhat lower rates than for wild type. The good news is that certainly the mRNA vaccines and probably the J&J vaccine appear to provide very, very good protection from severe illness and death. So in fact, breakthrough infections are occurring at a higher rate than we had seen previously, but the effectiveness of the vaccines against getting sick enough to wind up in the hospital and die appears to be pretty well maintained. Early information suggests that Delta may be worse in younger individuals than the prior variants, but this needs extensive confirmation, and I'm not sure I trust that data yet. It's a lot of anecdotal stuff, and we really need a lot more experience and well-designed studies before we say that. It may be producing an illness at least a little different from what we've gotten used to with COVID-19, with maybe more GI complaints and possibly looking a little bit more like a common cold initially than previously. We'll see as the cases accrue, but I think the main message is that if you're sick, you need to be tested. If you have GI illness or a cold, or the more common lower respiratory manifestations that we recognize with COVID, you need to get tested so that we can keep our surveillance accurate. In developed countries where it has become dominant, and this is especially the United Kingdom and Israel, reestablishment of distancing and mask mandates and travel restrictions that had been being rolled back are underway to control spread. And essentially in the UK, they have suspended their full reopening from originally planned for June 21st to July 19th or 20th next month while they assess the impact. Whether that's going to happen here or not is speculative at this point. If you're fully vaccinated, the current CDC recommendations, distancing and masking and physical distancing, social distancing and masking, are really not effective at this point. WHO is rolling back some of their relaxed recommendations. CDC has not moved in that direction yet. If you are not fully vaccinated, you should be avoiding crowded venues. You should remain masked at indoor settings where you will be coming into contact with other unvaccinated individuals, and continue with physical and social distancing as has been recommended for almost the entire pandemic. We know, as you have heard, that in Scott County, only about half the population is fully vaccinated. The vaccine is widely available for all 12 years of age and older, so that if you or people you know remain hesitant about receiving these remarkably safe and effective vaccines, you should immediately be in contact with your health care provider to discuss their position on these issues. And we have a lot of information at both county websites if needed. And of course, the CDC website is an exceptional resource. Our greatest concern right now, in addition to whatever the illness we will see during the coming weeks during the summer, is that Delta Plus, which has an additional mutation or two, and subsequent variants that are going to emerge, not be allowed to derail a return to full in-person schooling in the fall. So we really are encouraging everybody in the community to follow public health recommendations so that our epidemic curve doesn't turn in the wrong direction and we don't have to reconsider more restrictions than we're living with now.